Hello, I'm Dr. Elliot Hirschhorn of New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients suffering with chronic health conditions like thyroid disease. In this video, I'm going to discuss how is my brain impacting my thyroid and vice versa. Did you know that your brain has a direct connection to your thyroid? Did any of your other doctors mention that? Well, it's true. You know what that means? It means that if there is a neurological dysfunction, it can have a profound effect on your thyroid function. Before we get into the specifics of how that happens, let's talk about how your brain controls the production of thyroid hormone. Two main parts of your brain, called the hypothalamus and the pituitary gland, make up the hypothalamic pituitary axis. These structures are responsible for regulating most of your endocrine system and hormone production, including that of your thyroid gland. Your body constantly monitors your thyroid hormone levels. When the levels drop, your hypothalamus sends a message to your pituitary to get the process going. The pituitary releases TSH, or thyroid stimulating hormone. It travels to the thyroid and tells the thyroid to make more hormone. There are 7 main issues that can occur in the brain to interrupt this normal process that causes hypothyroidism. The first 2 have to do with neurotransmitters, which are chemicals in the brain that allow your brain cells to communicate with one another. The 2 neurotransmitters involved are serotonin and dopamine. They're also happy hormones, so when they are low, they can be associated with depression as well as have an impact on thyroid hormone production. What happens is that low serotonin and/or low dopamine can cause a lowered hypothalamic stimulation of the pituitary gland, which in turn lowers your TSH output, causing less thyroid hormone to be produced. Serotonin is mostly produced in your gut, while dopamine is produced in the brainstem. Altered function of either of these areas, as well as dysglycemias or blood sugar issues, can alter levels of these neurotransmitters. Blood sugar dysregulation can also cause increased levels of cortisol, a stress hormone produced by your adrenal glands. This elevation in cortisol can also downregulate the amount of TSH being produced by the pituitary and subsequently the amount of thyroid hormone from the thyroid. Prolactin, a hormone that's produced to initiate milk production in the breast, can also be involved in thyroid metabolism. In fact, elevated prolactin levels can also suppress TSH production through the same hypothalamic pituitary mechanism. Usually, elevated prolactin levels will be accompanied by noticeable milk production, so this pattern is fairly easy to detect. Fluctuations in prolactin leading to this phenomenon can be caused by changes in the neurotransmitters serotonin and dopamine and by the levels of hormones like progesterone and even thyroid hormone itself, creating this crazy loop kind of an effect. Inflammation is a common thread in all chronic conditions. Too often, elevated inflammatory status leads to poor physiological function, and that is certainly the case with regard to brain function and its influence on thyroid metabolism. Inflammation and all of the associated biochemical changes that come with it can also lead to hypothyroidism by its effect on the hypothalamic pituitary axis. There can be many causes of inflammation, including other chronic metabolic issues like blood sugar dysregulation, autoimmune disease, and even infections. Acute and chronic inflammation can also be initiated and sustained by head injuries, leading to a condition known as neuroendocrine dysfunction. Head injuries don't have to be something that even has an impact on the head or even knocks you unconscious. It can be as simple as a whiplash injury from a low-speed motor vehicle accident. Any previous head injury has the possibility of altering brain function in many ways, one of which is by activation of an inflammatory process that can result in neuroendocrine dysfunction, or NED for short. NED directly affects the production of releasing hormones from your pituitary gland. Upon laboratory testing, you'll see low levels of things like growth hormone, adrenal hormones, and the releasing factors, as well as low levels of TSH and thyroid hormones. Whenever a head injury is followed by a subsequent onset of hypothyroid symptoms, this pattern must be ruled out with a proper neurological evaluation and diagnostic blood testing. If you have thyroid symptoms and want to know if your brain is contributing to the problems and how I can help you, contact my office today at the phone number below to schedule a consultation and see if you qualify for care. Thank you and have a great day.